Autism is considered to be a spectrum disorder because while there are the three core deficits of language difficulties, social difficulties, and a limited behavioral repertoire, there's an amazing range of how those symptoms can present. So you've got what is referred to as classical autism, where the children tend to be more impacted. So they might have no functional communicative speech. So they never actually develop any type of language or a good way to communicate with other people. They tend to have lower cognitive skills, they tend to have less interest in socializing with others, and they tend to have more limited behavioral repertoire. So they might enjoy only eating one or two foods, and they might enjoy doing only one or two things, and oftentimes this might be unusual things, such as wanting to spin every item that they see and just watching it spin rather than actually playing with it. But and the spectrum goes all the way up to actually people who are highly gifted and who are very interested in socializing, but they just have some quirks, if you will, some unusual behaviors that sometimes make their social skills not as acceptable as one would expect from somebody who is so intelligent. And again, they oftentimes become very over-focused. What they're focused on, though, might be very broad. So it might be archaeology, it might be, astronomy. And the people with very high functioning levels of autism tend to have amazing amounts of knowledge, but it might only be in that one particular area, and it's not necessarily always generalized, and that might be the only thing that they're interested in talking about or communicating about. So there's a huge range, and therefore it has to be a spectrum because the children are so different. You can meet 3 children with autism and they can present 3 different ways, and that's why it's referred to as a spectrum. Well, while there's something that's called Autism Spectrum Disorders, that actually isn't what's considered the clinical or official term. The official term for any disorder that falls within the autism spectrum at the moment is called a pervasive developmental disorder, or a PDD. And it's called that because it's thought that autism is something that children are born with, and the core features stay with them throughout their life. So it's pervasive, and it affects their development. So it's a pervasive developmental disorder. And under that rubric right now, there is autism, and then there's Asperger's disorder. And Asperger's disorder is a bit controversial in terms of what it is exactly. But the thought at the moment is that Asperger's disorder is either the highest form of autism, so a very high functioning form of autism, or a separate disorder which is characterized by children who show more social interest than children with autism, children who tend to have higher IQs in the gifted range or have some skills that are extremely advanced. And then children who actually had language that developed on time, but it was unusual. So for instance, most children, no matter what culture they're raised in, their first words are movable nouns in the environment, because children learn, hey, if I make these noises, I get what I want, I get my needs met. So they learn to say mommy and daddy and bottle or baba. Children with Asperger's oftentimes have extremely unusual first words like clock or fish or mountain or sheetrock. And oftentimes these are indicative of what they might ultimately become very interested in. So a client that I worked with, his very first word when he was about 14 months old was sheetrock. And when I met him at 3, he actually, his favorite TV show was This Old House. He knew a lot about architecture. And so that first word was indicative of ultimately what became his overall interest. But children with Asperger's oftentimes have very advanced language skills, but it's used in a very pedantic manner, almost like what I'm doing now. It's almost like they're lecturing you rather than a reciprocal type of interaction where they're really trying to get information from you, share information back and forth. It's more like they're more interested in talking about their interests and telling you about them rather than engaging in what would be considered a true conversation or reciprocal interactions.